Hi guys, in this episode we're going to be looking at Accutane, which is also known as Epuris or Isotretinoin. I've been prescribing this drug now for acne for almost 20 years. Here's what you should know about it if you were planning on starting it. Generally we use this when all other avenues have failed. This is like our secret backroom weapon when all the pills, the potions, all the topical stuff, if those things aren't working for acne, we generally will pull up Accutane as our next stop. It rarely fails, but there's still potential pitfalls and side effects from it. So these are the 10 most common side effects that you might experience if you're on Accutane. Let's go. All right, so here are the 10 most common side effects on Accutane. Number 1 is cheilitis, which is chapped lips, and that was very common in 96% of users. Almost everybody gets sore, chapped, dry lips. Number 2 is face rashes. That was at half of users, 55%. Next up was dry nose, which was 51% of users. Then at number 4 was peeling skin. I hope you're starting to see a little pattern evolving here. So peeling skin, that was half of users precisely at 50%. Number 5, skin again. Itching. Oops, sorry there. And then number 6 was dry skin. The itching was a third of users at 30%, and the dry skin about 1 in every 5 users, 22%. Next up was dry, red, or sore eyes. That was noticed in about 19% of users. Next up we have hair loss. That was noticed in approximately 13% of people. Hair loss or hair thinning. Then number 9 was body aches of unknown origin. That was again 13% of users. And then finally we have rash, and that was in about 1 in every 10 users. So hopefully you would see that the trend here is that almost all of the side effects are relegated to the skin system. And that makes sense when you consider that Accutane or Isotretinoin, Epuris, are targeting the cellular structures of the skin, trying to deny it from making excessive oils, which then cause the acne process. So it makes sense, as it focuses on the skin, that you're going to get most of the side effects in that system. Now, there's 2 other really important side effect categories that we need to look at, which are not that common, but are very consequential if they occur. So the first is lab value changes. In about 15% of people on Accutane, their liver doesn't like it. It seems to burn it, and it causes an elevation in the liver function numbers when we test it through your blood. Most cases of people that this happens to are not actually aware of it. Up to a month ago, I had to call a client of mine who was demonstrating some liver function derangements. And another one that wasn't coded by the manufacturer, which I've seen over the years, is also not just liver function elevations, but also pancreatic elevations. So the 2 clients that I might be a little wary of using Accutane with would be those that have pre-existing liver disease or some genetic problem with their livers, and the other is people who have had pancreatitis before for whatever reason. With those cases, it doesn't mean you couldn't use it, but you probably need to scrutinize it more frequently. So usually within the first month, I usually give people a lab requisition to go and check these parameters. Sometimes prior to taking the Accutane, I'll do that as well to do a comparison afterwards. If you see a sudden shift and rise in those numbers, then that might mean that all is not well in Gotham, and you might want to consider either backing down the dose or coming off of it altogether, depending on how severe it was. The other one is an elevation in your blood fats, triglycerides, and cholesterol. About a quarter of people had an increase in their triglycerides. 10 in every 100, roughly, had an increase in their cholesterol. Now, that being said, most people taking Accutane and Isotretinoin are usually in the tween years. So usually at that age, your cholesterol and fats are usually excellent anyway. It's also just a temporary effect. Once you come back off the drug, your numbers recover and go back to normal. So I've never seen this as a deal breaker for using Isotretinoin or Epuris or Accutane. Now, the final really critical one that I don't want you guys to miss is in females using Accutane. Accutane has been proven to be a teratogen, which means it can cause fetal malformations such as cleft lip, learning disorders, not good stuff. So any female going on Accutane, please make sure you're not pregnant before you start it. If whatever system you're going through forgets or neglects to do a pregnancy test, make sure that you haven't missed a period before you start on Accutane. It's very important. So, what are my final thoughts on Accutane? Well, as a physician, I like it because I find it very effective for people who are suffering with it and come to me for help. However, you have to remember that Accutane and acne are not essential treatments. It's not like me treating your diabetes or your hypertension. It's more of a cosmetic therapy. But that being said, and taking the consequences of side effects into consideration, acne tends to strike at your peak reproductive period of your life, which is also when people want to look their best. And it can be very mentally distressing for some people. Like I've seen some people extremely depressed, suicidal because of acne. So all in all, you have to weigh the benefits. Do they justify the rewards or not? Every case is individual. Generally, I would suggest not starting with Accutane. That should be your last go-to. Initially, you should be using the topicals, the other potions, antibiotics, benzoyl peroxide, etc. But if those things are failing for you, Accutane then is your guy. Another thing you also have to remember is acne, juvenile acne. There's also mature onset, but that's not what we're discussing here. Juvenile acne, if you're patient enough, eventually you'll outgrow it. I remember having acne myself. So again, you have to look at the pros and cons. Is it worth it? And a lot of that depends on how badly, how severely your outbreak is and how much it's affecting you mentally. So guys, there you have it. That's Accutane in a nutshell. Thank you for watching, and I'll see you next time.